A little while ago, I was working the ER and a 6-year-old child was brought into the ER after he was going down a slide, collided with another kid, and fallen off the slide onto an outstretched right hand and had severe deformity of his right wrist. And he was crying and screaming the entire time that he was being registered and triaged and then brought into a bed immediately afterwards. And from the moment that I laid eyes on his wrist, I knew that it was really badly broken. I wanted to minimize any movement to spare the kid from pain. So we administered intramuscular ketamine for both pain and sedation. And once he was adequately sedated, we shot a portable x-ray shown here, which shows a fracture dislocation of the wrist just proximal to the growth plate. So we put him in finger traps in his index and middle finger and suspended him from an IV pole. And I got my medical student to apply downward traction of his elbow while I manipulated his wrist to bring it back into anatomic alignment. And once I was happy with the alignment, I put him in a cast that went from his hand all the way up to his armpit in 90 degrees immobilization. Shot a repeat x-ray shown here, which shows really good anatomic alignment. So I reviewed the x-rays in the case with the on-call pediatric orthopedic surgeon, and the patient was subsequently sent home to follow with an orthopedic surgeon upon his return to his home country in a couple of days. And this is definitely one of the worst orthopedic injuries that I've seen in a child.